Hi, everybody. Long time no see. It's nice to be here on this kind of cold and cloudy morning. So I'm staying in, and so I thought I would do a video. So many of you know that this year I was diagnosed with breast cancer, and I've been practicing a very holistic approach, mind, body, spirit, to help me to heal it. I've also been doing some integrative stuff, and I did make the very difficult decision to go ahead and have a double mastectomy. I didn't take it lightly, even though I was able to shrink the tumors a little bit. It was a pretty advanced case when they finally got diagnosed. So, that being said, I went ahead and made that decision, and it's a difficult one for all of us. So, whether you're here because you're having a lumpectomy, single mastectomy, double mastectomy with having lymph nodes removed, whatever the situation is, you're here. I chose to do this video because before I got the mastectomy, I really didn't know what I needed. I looked up online and there's a lot of stuff all over the place, and a lot of it's from people who haven't ever had mastectomy surgery or any sort of breast cancer tumor removal surgery. So I don't think they really know what I need either. So that being said, I decided to make this video for people who are going to be going through this process to give you some ideas on what you might need and things you can do before you go into surgery. You can have everything prepared so that when you come home, you don't have to try to do it on your own or have people help you do it. It's very difficult. That's kind of what happened with me. I was fortunate to have a really wonderful husband, and family was here, my sister, and they took care of me, but there was always somebody at the store, or there was missing something or whatever. So I decided that I thought it would be a good idea to do this. I'm going to have links below of the videos that I refer to. I'm also going to have a list. There should be a list down there that lets you know all of the things that we discussed. So take everything with a grain of salt. I go through a very mind, body, spirit approach to things, whether it's healing or it's anything else, decisions that I make. I always go through all three of those things. So this is a mind, body, spirit. So I'm going to be talking about primarily holistic methods of things. Just to let you guys know, I'm not any sort of a medical practitioner in any way. I'm not licensed in any way. So everything that I'm sharing with you, part of it was my naturopathic oncologist shared with me, as well as just the things that I've learned and studied along the way of this journey that I have. Um, I'm happy to tell you that I don't have any cancer in my body right now, which is wonderful. And so that's super exciting. And I wish that for you as well. Sometimes going ahead and having surgery is part of that option. But breast surgery is uncomfortable. It's painful. There's a lot of stuff that goes on. So you want to be as prepared as possible because you're going to need some things that you may not think you're going to need. Now, depending on the severity of your surgery, it's going to depend. I always go ahead and plan for this stuff for the worst case scenario. And then I intend that the best case scenario happen. But just in case, let's just go ahead and have some things that wouldn't hurt. Okay, so we're going to start with the mind component of things because this is the one that I really struggled with the most. I get in my head a lot and I start to experience negative thinking and things like that, especially before surgery, because I have a little bit of a hospital phobia in general and medical community phobia. So yeah, this is one that I really struggled with. My naturopathic oncologist suggested that I start doing some meditations designed specifically to help you pre-surgery. Two of them that were really good are by a woman named Bella Ruth Naparstek. And you can get these anywhere. You can get them on Amazon. I think she even has a website. I'll have links again below to everything. One of them is called Fight Cancer. Now, I don't love that word, fight cancer, fight, but it actually helped me to visualize decreasing tumor size, which actually worked because when they actually went into the surgery, the tumor had shrunk without any other intervention. So Another one that she has is called Successful Surgery, and it's just general surgery. Again, both really helpful. I found my recovery's been faster than your normal person, and I think that it's due to prepping myself and doing these meditations twice a day. I started about 2 weeks before surgery. I also incorporated EFT tapping into it. I used Brad Yates on YouTube. He's a really fantastic EFT practitioner. He had a few that were really helpful for me. One was playing the hand you were dealt, which helped me to go through my process of recognizing that this is all happening for a reason. I was going through a lot of emotions. I wasn't tapping to get rid of the emotions. You need to feel your feelings. But what it did was it helped me to see things from a bit of a bigger perspective and to get rid of that mental chatter that was going on and causing me some problems. I also looked at tapping through pain, and I started using this again 2 weeks before surgery. So I had it pretty much in my head after surgery so that I could use this as a tool for pain management. Another one that I used for him was from him was called Being Present. And that helped me to, again, get out of my head and stop looking at worst case scenarios, because I'm spending all this time visualizing positive outcomes with meditations and things like that. So I wanted to make sure that my brain was on board with all this. So I did a lot of brain training. It's also really important to, as far as the mind goes, to make a list of everything that you're going to need, potential meds, have like a medication list so that people who are helping you, or even you know when you've taken what, because believe you me, you are going to want the medications that they give to you. Have your surgeon go ahead and prescribe them before surgery. They will probably prescribe narcotics. They'll probably prescribe an anti-inflammatory, things like that. Go ahead and take them. It doesn't mean you have to use them. You might not feel that bad after surgery, which would be great. Most people, they need a little something to help them get through the first couple of weeks. And so go ahead and get that beforehand so you don't have to worry about trying to go get it after, which is what we did. It didn't work out so well because I was in severe pain after surgery, especially day 1, day 2, day 3. So have those on hand. Make sure your house is clean before you go, because you're not going to be cleaning for a while, sister. It's not going to happen unless you have a maid or you have people who are taking care of you. Your house isn't going to get clean for a while. So just go ahead and have it nice and tidy. Have your bed and your healing space ready to go where you're going to be healing. We'll talk in a second about how to get that together. All right. So that's the mind component of it. Just make sure that the mental load is all done before surgery. And so you can just focus on healing and not have to worry about that stuff. Let's talk about the body. All right, these are things that we're going to want to have on hand before surgery. And most people, including people who are just having a lumpectomy, and I don't say just because they can also be uncomfortable, you're going to need most of these things. One of them is, if you don't have a bed that automatically adjusts up and down, you're going to want to go ahead and get a wedge pillow. A wedge pillow is just simply to help you to kind of sleep at an elevated position, and even just lie down in an elevated position. You're going to have a hard time sitting up, getting out of the bed, getting to the restroom and things like that, because you're going to have a lot of pain in this area. All these muscles are going to be interacting with the injury site, because this does do intense injury to the body, mastectomies especially. It does a little bit of nerve damage and it messes up the muscles, and you've got internal damage actually. So going ahead and having something that's going to help you not have to lift yourself up and use those muscles for a little while is really helpful. Also, it's recommended that you set up to sleep to help with drainage, and you are going to have drains on the front of your body for a while. So you're going to need to sleep on your back. And if you're a side sleeper, I'm sorry, I'm a side sleeper. It was awful. But I ended up getting an adjustable bed about 3 days and he had it delivered same day so that I could just click a button and sit up and lay down, because my family was having to actually get me out of bed just to go to the bathroom. I'd have to wake somebody up at 3 o'clock in the morning to help me sit up so that I could go to the restroom. But a wedge pillow can also help with that as well, if you get a good one, a good quality one. Another thing that you can get is what's called a cuddle pillow or a mastectomy pillow. I did not get one. I used a regular pillow, but they wrap all the way around you and you can put your arms up on top of them. You'll find that after breast surgery, even especially if you get reconstruction, if you just get the mastectomy and a flat closure, it's uncomfortable, but when you get reconstruction, it can cause even more pain, like in the same day. So you definitely want to get one of these. You can also put ice in it, ice packs and things in it, which is another thing that's really important. Get as many ice packs as you can, get a bunch of them, and get the ones that are soft and they're bendable. And they usually have like velour or something on the other side. You can also get round ones. Actually, my surgeon, when I was leaving, the nurse gave me a couple of round ones that I could stick inside the binder that I had around my chest. You will wake up with a binder on you of some kind. Most people wake up with a big bandage around their chest. What that does is it holds everything together as you go through a healing process. It keeps your body from filling up with fluid, because it will. It will keep the drain site, because you're going to have drains attached to you. There are these tubes that are attached under your ribs, and they're big. You don't think that they're going to be big when you see them online, but they're actually quite large, and they take up a lot of space. And so it's going to kind of hold all of that together, and you have these drains on the outside. Now, some people will wake up with a mastectomy vest. I did not. I had a binder that I had to wear, and you're going to have to wear compression pretty much 24 hours a day, 7 days a week. You just take it off to bathe yourself and to clean it. Some people have it in as little as, 3 weeks, 4 weeks. Some people have it for months. It just really depends. So my recommendation is that before you go into surgery, that you go and you look at some mastectomy vests. So this is the one that I have. Again, I used for the first 2 weeks, I used the binder that they gave me. It was horribly uncomfortable. It hurt my armpits. It was awful. So I ended up getting this mastectomy vest. This one's cool because it has pockets in it. So, you can put ice in there. You can put these pads in there. These will help you and kind of compress the area even more. And plus, they make you look a little cuter, so you're not so flat, because you will be really flat. If you got reconstructive surgery, sometimes you can get smaller pads that you can put in there just to cover the breast itself, because I got to tell you, this stuff, the compression can be really uncomfortable, and that can help. You also want to get one. This one didn't have it because I got my drains out in a week. Some people, they can last as long as up to 6 weeks. They take them out when you have less, when your fluid is decreased and you don't have so much fluid coming out of you. So some of them have a little hole in them that you can pull the drains through. Some people cut holes in them. For me, if I had been wearing this, I would have just gone ahead and had the tube go outside, and then I have these little things that I bought. They're these little pockets that you can put your drains in, and you just Velcro them to your vest. There are some vests that actually have pockets in the front for you. You can get t-shirts that have pockets in them, like mastectomy t-shirts and reconstruction t-shirts. Also, when you get a vest, you want to make sure, especially if you've had reconstruction or you have a single mastectomy or even just a lumpectomy, that they have some give in there, so that they'll go around the breast tissue that's still left. Everything needs to be held into place. This one does both. It either goes flat on you, or if you have some breast there, it will, it'll go ahead and poof up. You can get other ones that are designed specifically for people who've had reconstructive breast surgery, or, they've gotten implants and things like that. So you can take a look at those too if you got reconstruction. But all in all, just get one and get a good quality one. Don't skimp. The first one I bought off of Amazon, and it was okay. But when you're wearing something 24 hours a day, you want something that's not going to irritate your skin. You can also get like some gauze pads, just some gauze pads and things like that. If it's really bothering your armpits, you can just kind of stick them in the bra or the mastectomy vest or the binder, whatever you're opting to use. That can be helpful. Another thing that you're gonna want to get is you're gonna want to get some just waterproof bandages. So in most cases, you're not going to be able to shower for a while and just do sponge bath, at least until you get your drains out, because your drains, when they put them in, and they are like the size of a pencil, meaning you have a pencil sized hole that's open. So you're going to constantly have bandages on them, and you are going to have the wounds are going to seep a little bit. And then when you get the drains out, they're really going to seep because they yank them out, and then, you know, they put a bandage on them, and that bandage has to stay for a while with some antibiotic on them so that you don't get an infection. But they do get a little messy. So you want to make sure you have bandages on hand for you. What else? Okay. I said ice packed, get your meds filled beforehand. Another thing that I found really helpful having on hand was having some arnica cream and some CBD cream. I use a company called Fern Valley Farms. They're local in Oregon, and they're fantastic. It's a wonderful cream, and I also used their CBD hemp for, you know, just taking internally as well to help me to heal. I have a couple of homeopathic remedies that I used. A lot of times with mastectomies and breast surgery in general, there's nerve damage. And as the nerves are healing, you get these zinging pain. It's like getting electrocuted. I'm not going to lie, ladies. So a homeopathic remedy that I used is Hypericum perforatum. And I had a bunch of people send me over this way. I had to have somebody go and pick it up for me. And I wish I had a day one, because within 24 hours of me using it, my nerve pain went away. I also started taking a homeopathic arnica, as well as taking this is called Graphites, which helps with scarring. So I started taking all that stuff as soon as possible, as soon as I had it. You want to have that on hand before, again, because you can start taking it right away. I also did a pre-surgery thing at the suggestion of my naturopathic oncologist called pectin. I used a form called Pectisol. And what this did is when you get breast surgery for cancer, sometimes the cancer cells will try to you'll always have a few errant ones. They'll try to recolonize. So this stops them from recolonizing. You can take it 2 weeks before and then like a week afterwards. So this can really be helpful for people who are, you know, concerned about a recurrence. Again, talk to your doctor about that, see if it's acceptable. So she also had me on vitamin C, vitamin A, a bunch of antioxidants, green tea extract before surgery. And then I also had it after surgery. So you want to get it for before and after. Again, you'll find out from your surgeon how soon before surgery you have to stop taking antioxidants, because they get concerned with you having bleeding and having issues clotting with it. So talk to your doctor about that. With diet, the one thing you want to do before surgery, at least in the weeks before, however long you have, the second you find out you're going to get surgery, but really the second you find out you get cancer, start flooding your body with nutrients. I mean, I have a veggie smoothie every single day. I have nothing packaged. I eat fruits, vegetables, lots of cruciferous veggies, berries. I have at least one meal a day that has five different colored vegetables in it, right? This is really important because it's going to help you build healthy tissue again. It's going to help you build a healthy body and replace all those yucky cancer cells with healthy cells. So it's really important that you do that. Now, the last component of this is the spiritual component. And again, this is us prepping for the surgery. There's way more to it. I'm going to have a bunch of videos about all this stuff, but the spiritual component of it, when you're getting ready for surgery, it's really important to make sure that you are connecting in and healing trauma and doing some trauma healing work, because we created this for a reason, right? And so we want to get to the depth of what that reason is. And we want to do it before we have surgery, because after surgery, it's going to be hard to do this sort of work. Do it when you're still feeling okay and you're healthy. We also want to deal with our emotions. So it's important to feel your feelings, to let yourself go through your grief, let yourself go through anger. There's a lot of things that happen, especially if you're getting a mastectomy, whether it's single or double. And regardless, even if you get a lumpectomy, the map of your body is going to change regardless. So it's important that you go ahead and feel your feelings. I have some really great videos. I've shared the link below that can help you with this, to just do some healing work around the trauma that may have created this disease to begin with, and even just the trauma of going through this process of trying to heal cancer. It's very traumatizing, especially if you've opted for more conventional, traditional methods like chemotherapy and stuff. Again, that can really cause a lot of issues. Doing energy work for yourself is going to be very helpful. And I have a video with Gold Light meditation. If you don't know how to do any energy work, if you're a Reiki practitioner, use that. Do self-healing every day. Make it a habit so that after surgery, you can do it as well. The Gold Light is good. The meditation's really nice if you're having trouble, pulling energy for yourself after surgery, which is not uncommon. You can just listen to that, and you can get some beautiful source light coming in to support you. It's a very coded, free video, so I suggest that you try it. Cope with your anxiety and the hopelessness that can come up sometimes. If you're not feeling anything negative, that's wonderful, but I would invite you to really take a look at, are you being stoic? Are you trying to be strong? You want to just go ahead and make sure that you're honoring your feelings, because cancer is literally, it's compressed emotional energy that hasn't been expressed. So it's really important to go ahead and let that come up and out. You don't want to live there and stay there, but you want to just let it do it. So again, I have another video. That healing trauma video can be very supportive for that as well. Just helping you to move through emotions, help you to go ahead and honor your anxiety. It's a very scary situation. There are a lot of videos. I use Insight Timer for meditations. I did a bunch of stuff around self-love because I recognized that what the tumors was a piece of me that needed more care and love and attention, that had just kind of frozen in time, and I needed to support it. Insight Timer is free. You can get it on any phone that you have. You can also get it on the internet, just on your computer if you want to. They have some wonderful meditations for self-love, as does YouTube. So find one that feels good to you and do it every single day. You need to emotionally support yourself. Join a support group. Reach out to friends who've had similar issues and similar things with cancer. There's tons of social media pages. Go to therapy. Do whatever you need to do. Your family's only going to be able to support you so much, because they're probably freaking out and panicking too, because they may be losing their touchstone. So, who's going through the process and they're just not used to it and they don't know what to do. So, your family may need support, but right now, that's not you. That's not your problem. You've got to go ahead and focus on yourself and take care of you. Focus on you 2 weeks prior and immediately after. Give yourself time. I actually took a month off of work and of everything. And I had everything prepped beforehand to make sure that things were taken care of, so that I wasn't going to have to do a thing. And that really helped me. If you're going through this alone, reach out to the community and see if there's any support for you available through insurance, nonprofits, whatever, because you are going to need some support. If you need to go into palliative care, talk to your doctor about that. Say, I'm doing this alone. And if you're having extreme surgery, double mastectomy, having lymph nodes removed, that may be an option for you. So find that out. And above all, give yourself permission to let other people care for you. This is the hardest thing for a lot of us as empaths and as healers and just as women in general, is, it's hard for us to let other people care for us. So give yourself permission to lay back, relax, and go ahead and let your body do what it needs to do to heal you, right? So it's really important to have all of these things ready to go before you get on that table. And talk to your surgeon, talk to your oncologist, get all the tools that you need, take what you need from this. You may find that there's other things, but get a list going so that you know what you need and go ahead and take care of it. I wish you all the best and all the luck, and may be healed. And I hope you find this video of benefit. And if you need anything from me, my website is barbarabuck.org, and I will be there for you. Take care. Bye.